So pharmacies that we own and operate connected to in-home technology, where we have a medication dispensing device and data collection hub that basically solicits information from patients up to 4 times a day. And that data flows up into our platform, where we have a team of remote clinicians that actually do something with that data. And we actually have hooks into EHRs and EMRs. So we have a full set of data from pharmacy, coming out of the patient, analysis by our clinical team, and then we send recommendations to physicians in real time. We're very proactive in the care of patients.
All right, welcome back inside our proactive newsroom. And joining me now is Shane Bishop. He is the CEO of Custom Health. And Shane, it's great to see you. How are you?
I'm good, thank you. Yeah, thanks so much for the invitation. Looking forward to the conversation.
Yeah, excited to learn a little bit more about what you're doing with the company. It's a very unique company. It's interesting because I was researching it. I noticed that I read about the history of the company, which is unique because you were assessing that there was a challenge and some problems, especially in long-term healthcare, that needed to be fixed. And that's kind of how the company was born, right?
Yeah, so I'm a pharmacist by profession, and in the early days, yes, we actually identified that there seemed to be a systemic problem between pharmacy and nursing in long-term care facilities, and how to address medication administration in the most accurate way possible. So yeah, we jumped into technology and helped resolve that issue and concern, and that product and solution is still part of what we do today. But that was the kind of the starting point in how do we address the population in the home? The prototype of that model started in long-term care with a lot of success. So yeah, very excited to jump into kind of what we're doing, kind of going forward here.
Yeah, so let's talk about that because the company has evolved since that day, and obviously you're at a really unique place right now. So tell me how the company's operating today.
Yeah, so we've taken all the learnings from what you were just talking about, the long-term care side. And what we've done is we've actually ended up building the infrastructure that connects pharmacies that typically we own and operate. And I'll jump into that model a little bit. So pharmacies that we own and operate connected to in-home technology, where we have a medication dispensing device and data collection hub that basically solicits information from patients up to 4 times a day. And that data flows up into our platform, where we have a team of remote clinicians that actually do something with that data. And we actually have hooks into EHRs and EMRs. So we have a full set of data from pharmacy, coming out of the patient, analysis by our clinical team, and then we send recommendations to physicians in real time. We're very proactive in the care of patients, and that's really starting to take off.
Yeah, so if I'm a patient, what sort of things would I see at my home so I understand how each sort of part of the business would work then?
Yeah, for sure. I mean, I'll give you an example of like
Yeah.
one of our focuses right now is on pain management, especially in the USA. We just happen to do some very significant opioid reduction services in the US, where we've actually managed to lower the amount of opioids patients take by 27%. So it's a really big number. And if you look at our platform of tracking a tablet through the entire system, full chain of custody tracking for opioids. We're starting to sign up all these very large pain providers in the U.S., which is fantastic. So typically, what happens with a patient is that we'll receive their prescriptions into a pharmacy that we own and operate. We package all of their prescriptions into this special cartridge of medications, and we deliver this cartridge of medications with their morphine tablet in it to the patient in the home where they have the device. So this cartridge drops in, and then it loads by itself. And then what will happen is the device will kind of beep and flash and whistle at the time of administration. So the individual at home touches the screen. Out comes that pouch of medication. We take an image of it. So now we have the image of the opioid in the example of pain management in the patient's hand. So full chain of custody tracking. But what gets really cool is that we actually pop a question up on the screen. In this case, what's your pain level right now, 1 through 10? You know, 91% of the time, patients respond to those questions, and that data flows up to our platform. So our team now has access to, did the patient take this medication? What was their pain level? And if we see an individual has not been in pain or their pain's under control for the last 30 days, we'll likely engage the patient, reduce the amount of opioid they're taking, right, to minimize the risk of addiction, opioid use disorder, and send all that information to the doctor. So it's a very proactive care platform for the patient, and physicians love it because obviously we're really taking care of the patient in real time.
Absolutely. You had, I was reading and also researching, you just made an acquisition as well. And this was a company, Innovative RX, that you're actually working with already. And so just building the brand up a little more.
Yeah, I mean, so what we're doing is we're targeting to pharmacy acquisitions as part of our model in key geographies where we actually have payers for this, for the solution that we just discussed, in-home technology, working with physicians. So we are targeting pharmacies. They were actually pharmacies that we were already working with. So there's already payers established around these pharmacies. We find when we own pharmacies, we can control the cadence at which we deploy, the
Sure.
quality and everything like that. They're an amazing group of pharmacies that joined us. So from the growth strategy side, it's great because we have an inorganic growth strategy with an organic growth over top by these patients coming into our pharmacies. So we can make an acquisition that's accretive and then grow that pharmacy by piling on all the patients that we have under contract. So it's a pretty cool model.
Yeah. And Shane, do you see it as growth on both sides of the border in North America? Is that the plan is to grow on in Canada, but also the US as well together at the same time?
And, I think realistically we have more payers lined up in the US. There's more
Yeah.
accessible funds for this type of service, driven by pharmacy. So I see it being more of a 20-80 rule. 80% of our growth will likely be in the US, likely
Sure.
20 in Canada. Lots of opportunity in Canada as well. We have some good things happening. Everyone has the same issues. Just the payers are aligned a little bit better in the US for what we're doing. So
Okay.
that'll probably be more of our focus.
Okay, let's talk about some happenings. TSX, you're now listed on there. You're trading as of June 24th. A CHLT is the ticker. So obviously, it's a natural progression with the company to
Correct.
get access to the capital markets.
Yeah, I mean, our model is, continue to bring in some, equity for growth, the organic side, right? Deploying devices into the patient's homes and building the team and getting the data and providing that service. And then, leveraging, the stronger balance sheet in the capital markets to actually be able to, you know, bring in the lenders that can help us make these acquisitions, right? So that's kind of the model going forward. Much easier to do that in a public market. Our acquisitions are typically a cash, stock type of transaction. So this allows us to grow quicker. And yeah, we're so excited to be on the TSX.
All right, let's talk about the rest of this year and beyond. What sort of things that people should be looking at for the company moving forward?
Yeah, I mean, I think, keeping an eye on what we're doing, the growth in key geographies where we have payers, and, we'll obviously be making, announcements, throughout the year and the next 12 months on where we're signing the larger providers and, looking to establish a footprint of pharmacies. And I think that's going to create a lot of excitement, in the market for sure as we take, what would be seen as almost a traditional roll-up strategy of pharmacies, which exists today, but really driving the SaaS tech service revenue on top of the pharmacy revenue, which is very unique and exciting. We seem to have the secret sauce at the moment, so we're just gonna drive that forward.
All right, well, we'll keep an eye on the story for sure. A really intriguing company, and you've got a lot of things on the go. So we'll look forward again to covering your story. So, Shane, thanks very much. Good to see you.
Thank you, Steve. Take care of yourself. Bye now.
All right, there's Shane Bishop, CEO of Custom Health.